The plank is one of the simplest and most effective exercises you can do. No equipment, no fancy gym, just you and the floor. It's incredibly versatile and only takes a few minutes a day. But have you ever wondered what would actually happen if you committed to doing a plank every single day? In this video, we'll break down the benefits, the risks, the correct technique, and how long you should hold a plank to get the best results. Stick around till the end. It's going to be interesting. 1. Core strength and organ support. The plank primarily targets your core, the abdominal muscles, obliques, and spinal erectors. These aren't just six-pack muscles, they actually support your internal organs. One of the main causes of abdominal hernias is weak core muscles. If your core is strong, the chances of a hernia drop significantly. So planks aren't just about aesthetics, they're a foundation for your health. 2. Safer back development. Planks are an excellent way to strengthen your back without the injury risks that come with heavy lifts like deadlifts. While the deadlift is powerful, it requires perfect form, and many people end up injuring themselves. Planks, on the other hand, are much safer. Done correctly, they strengthen both your lower and upper back, which can help prevent back pain, something most people suffer from due to underdeveloped back muscles. 3. Improved posture. Good posture is more than just standing straight. It projects confidence and impacts how others perceive you, and planks directly help with that. By strengthening the muscles in your core, shoulders, and upper back, planks pull your body into alignment. After just a few weeks of consistent planking, many people notice visible improvements in their posture. That means standing taller, moving better, and even looking more confident. 4. Boosted metabolism and fat loss. Doing planks daily can increase your metabolism. How? Because they activate multiple large muscle groups simultaneously. The more muscle you engage, the more calories you burn, even at rest. Over time, this can help reduce body fat. Combine regular planking with proper nutrition, and you may start seeing those abs you've been working for. 5. Enhanced coordination and balance. Ever try standing on one leg and feel wobbly? That's your stabilizer muscles at work. Or not. Planks strengthen these tiny, often overlooked muscles, which are crucial for balance and coordination. Whether you're into sports or just want to feel more stable on your feet, planks train your body to be more controlled and steady in movement. 6. How long should you plank? The ideal duration depends on your fitness level. If you're a beginner, start with 15 to 30 seconds per set. Don't rush to hold a plank for as long as possible. It's not about endurance to the point of failure. What matters most is form. Several sets of shorter, high-quality planks with proper technique and rest in between are far more effective and safer than one long, shaky hold. A good structure might be: hold for 30 to 60 seconds, rest for 1 to 2 minutes, repeat for 2 to 3 sets. Plank pros and cons. Pros: simple and accessible, builds core, back, and shoulder strength, enhances posture. No equipment needed, can be done anywhere. Cons: poor form can strain the lower back or shoulder joints. Holding too long can elevate blood pressure, not suitable for everyone. 8. Common mistakes and correct form. There are over 100 plank variations, but let's focus on the classic forearm plank. Start in a push-up position and lower down onto your forearms. Elbows should be directly under your shoulders. Body should form a straight line from head to heels. Don't arch or sag your lower back. Keep your core tight, glutes engaged, and legs straight. Breathe deeply and steadily. Don't hold your breath. Tips: relax your neck and keep your gaze slightly forward or downward. Avoid letting your hips rise too high or drop too low. Quality over quantity. Good form is everything. 9. Who shouldn't do planks? Contraindications. Planks aren't for everyone. Avoid planking if you are pregnant, have a recent back injury, suffer from hernias, experience joint pain in shoulders, elbows, wrists, or ankles, have uncontrolled high blood pressure. Always consult a healthcare provider if you're unsure whether planks are safe for you. If you found this helpful, hit the like button, share it with your friends, and subscribe for more health and fitness content. Thanks for watching, and see you in the next one.